Trilogy 100 is a small, portable ventilator that's easy to use. To become familiar with the system, let's take a good look at the unit itself. Here on the front, you see control buttons, visual indicators, and the display screen. The Start-Stop button at the bottom starts and stops the flow of air, which is how you begin or end therapy. Above it is an audio pause button, which temporarily silences the audio portion of an alarm. If the cause of the alarm is not corrected, it will sound again in 1 minute. Here, underneath the display screen, there are 3 white buttons. The up-down button in the center lets you move through the display menu and edit device settings. The left button is used to select display and menu options, which appear on the left side of the screen. The right button does the same for options on the right side of the screen. To make the unit easy to use in a darkened room, the Start, Stop, Left, Right, and Up-Down keys have LED backlights. You can turn these lights off if they interfere with the patient's sleep. Here in the bottom corner is a small green LED light. When this is lit, you know that Trilogy is hooked into an active AC power source. The display screen serves as the information hub for Trilogy 100. Here you can view settings, select options, and view alarm indicators. On the right side of the unit, you can see the AC power inlet. When you plug the ventilator in, the socket end of the cord connects here. The round opening above it is the breathing circuit connection. The tubing fits snugly onto the ventilator here. The device we're looking at now is fitted with a passive exhalation porting block, which is this piece in the back. If you're using an active exhalation porting block, your device will look like this with 2 additional connection ports. Let's look at the other side of Trilogy. The slot is for a secure digital or SD data card. This is an optional card that collects ventilation data for your physician. On the back of the Trilogy, you'll see an air inlet which holds a gray foam filter. The filter, which screens out normal household dust and pollen, is washable and reusable. You must have the filter in place when the device is operating. On the other side of the ventilator is a detachable battery pack slot. A lithium-ion detachable battery pack is used to power the device and attaches here. Looking across the bottom, there are a number of connections and ports. You can secure the power cord using the cord retainer. A serial connector lets your home care provider connect Trilogy 100 to a computer or another Philips Respironics device. If you use an optional remote alarm, you attach it here to the remote alarm connector. Your home care provider may connect a PC to your device and upload information about your therapy using an Ethernet connector when available. An external battery connector lets you hook up an external standalone lead-acid battery to Trilogy 100 using a Trilogy 100 DC battery cable. And finally, an oxygen valve port is available for patients who require supplemental oxygen. Trilogy 100 is easy to set up for home use. Begin by placing it on a hard, non-carpeted level surface. You can also place Trilogy on a stand or set it inside the optional in-use bag. Make sure that the air inlet port on the back of the device is not blocked and that air can flow freely around the unit. If the airflow is restricted, the ventilator may not work properly. Once Trilogy 100 is on a solid surface, you can start the setup by providing power. Trilogy can be powered by 4 different sources: AC power, an external battery, a detachable battery pack, and an internal battery. The device will always use AC power if available. When AC is not available, it will run on its external battery if connected. If the external battery loses its charge, Trilogy will run from the detachable battery pack. When no other power source is available, Trilogy will rely on its internal battery as a last source of power. Immediately seek an alternative power source when the low battery alarm occurs, because loss of therapy is about to occur. A manual resuscitator bag should be available for use just in case there is no power available. To use AC power, plug the socket end of the power cord into the AC power outlet on the right side of the device. Plug the pronged end into a wall outlet. The ventilator must be connected to a wall outlet that is not controlled by a switch. You'll know that the AC power is connected and the device is operating properly when the green AC power LED on the front of the unit is on. The ventilator can also be powered by an external 12-volt marine-type battery. One end of the Respironics DC battery cable is attached to the battery. Plug the other end into the external battery connector power inlet on the back of Trilogy. How long the battery will last depends on the battery and your device settings and usage. Trilogy 100 also features a detachable battery pack. When the device isn't connected to an AC source or an external battery, this will supply the power. Here on the back of the detachable battery, you can see a set of LEDs. Press the button below to see how much charge is left in the battery. When all the LEDs are lit, the battery is 80 to 100% full. Under typical conditions, a new fully charged detachable battery can power Trilogy 100 for about 3 hours. The detachable battery snaps easily back into place on the back of the ventilator. Trilogy 100 also has an internal battery, which can be used as a backup power source for shorter periods, so the ventilator stays on while you switch between external power sources or transport a patient. Under typical conditions, the internal battery can power Trilogy 100 for approximately 3 hours. When Trilogy 100 is connected to AC power, it will automatically recharge both the internal battery and the detachable battery pack. A completely discharged internal and detachable battery will take about 8 hours to recharge. The ventilator is designed to work with either a passive exhalation port or an active exhalation valve. An optional bacteria filter can be used with either type of valve. To set a passive circuit up, connect one end of the flexible tubing to the outlet of the optional bacteria filter. Insert the bacteria filter inlet to the breathing circuit connector on the side of the ventilator. If you aren't using the optional bacteria filter, attach the tubing directly to the breathing circuit connector. Connect the other end of the tubing to a mask with a built-in exhalation port. If connecting to a trach tube or a mask that does not have a built-in exhalation port, connect a Whisper Swivel 2 exhalation port to the end of the tubing. If you're using a passive system, your breathing circuit is complete. If you're using an active system, there are 2 additional lines to connect, and you will have a different exhalation valve. The proximal pressure line attaches to the top connection on the active porting block. The other end of the tubing is attached to the proximal pressure port on the T connector. The exhalation valve control line fits onto the bottom port. The other end is connected to the top of the exhalation valve. The active circuit is now connected. If the physician has prescribed supplemental oxygen, that port is here on the back of the device. Connect the oxygen tubing to an oxygen valve quick connect. Attach the quick connect to the oxygen valve inlet on the back of the ventilator. Make sure you press the oxygen valve quick connect firmly into the inlet. You should hear a click and see the tab at the top of the port pop up. Once Trilogy 100 is set up, you're ready to turn it on and interact with the screens. To operate Trilogy 100, you must be familiar with the screen display. In this segment, we'll review some of its symbols and operations. Press the Start-Stop button on the front of the device to begin therapy. The display screen and the backlights on the buttons turn on. The red and yellow alarm LEDs turn on momentarily, and an audible indicator lets you know that therapy has started. A startup screen with Trilogy 100 and the software version appears briefly on the display screen. The ventilator returns to the most recently defined ventilator settings, and a monitor screen appears. The appearance of this screen may vary depending upon how your clinician has set up your device. Trilogy 100 has a simple and a detailed screen view. Please select the screen view that looks most like yours. Thank you.